Welcome, everyone. As Chris mentioned, I'm LynAnn Henderson and honored to moderate this session on driving impact through voice, vision, and leadership. Today's conversation features two incredible women, kind of leaders in the field and close personal friends. They've really left their traditional healthcare system to build thriving direct care practices and lead a movement towards transparency, autonomy, and better outcomes. So we're going to talk about influence, innovation, and how each of you, our FMMA community, can help accelerate change. So I am not going to go into introductions since Chris did such a fabulous job, so we're going to just dive right into it. So Dr. Concepcion, I'm going to open with you. Let's start with your why. What defining moment led you to leave the traditional system?
So I definitely will say that I only knew the monopoly before I was given a letter. My husband is also a family physician, and we were both given a letter when we were 28 weeks pregnant with our second child and told, you will be fired unless you sign this contract where basically you have to see more cattle per hour. If you work at another job, we own your money. That was spoken about yesterday at Filescu's talk. Just things that were definitely not compatible with the joy of medicine or the joy of staying in that job. And so when I was on this journey of just getting frustrated more and more with the way that admins who did not go to medical school were telling us everyone has to have an A1C of 7.1, you have to have this many minutes for this type of visit. And it was so impersonal. I didn't know that there was another way. And so being fueled by that and then having an orthopedic surgeon tell me, you should look into DPC, I swallowed the red pill at that point. I went down the rabbit hole, but it was because I could no longer be in a position where I was at the mercy of a person who did not actually care about patients, who cared about profits, telling me that I didn't actually matter, that I just needed to go faster and sign the contract or else I would be fired. And so for me, that was my moment of clarity, and that was my moment of autonomy and advocacy that started.
Thank you. And Arti, similar question. Was there a moment or experience that kind of made it clear that the status quo wasn't working for you or your patients?
Yeah, first of all, thank you guys so much for being here and spending some time with me. I know your time is precious. A few moments. I was similarly in a traditional practice when I finished my endocrinology fellowship, and it didn't take me long to realize that if patients were even on the totem pole of importance, they were at the very bottom. And I don't know if the physician was above them or below them or also not on that totem pole. And, I got that dream job. I had the salary that I wanted, in private practice, and I thought it was the dream job. And then I got into it and realized it really was not enabling me to do the things that I was trained to do, that I had the passion to do, and I had the capability to do. One crazy moment was one of the partners in the practice gifted me a clock, a beautiful digital clock. And he said, put this behind your patients and they won't know it's there, but while you're looking at them, you'll be able to watch the time. And once 5 minutes has passed, walk out of the room. And I was like, this is a joke, right? Like, this is kind of funny if it's a joke. It wasn't a joke. And then I kept hearing from patients, like, the doctor just leaves in the middle of my sentence. They are just leaving. And I was like, what is that? Like, who does that to another person in any setting, let alone a healthcare setting? So that was a true gift of opening my eyes to the system. So thank you very much for that. And then another really sad experience. So we had a clinic that saw 500 patients a day between the doctors and the mid-level providers. And many of the patients would complain that they would call and wait for hours on hold and nobody would answer the phone. And I thought, that's ridiculous. That doesn't really happen. But then, 5 patients tell you the same thing. 10 patients every patient tells you the same thing. And you're like, oh gosh, there probably is something there's something to this, right? And so I sat in my office, called our clinic from my office to see what this hold time situation really was like. And I couldn't even get my call answered from my own office in my own clinic. And I was like, oh gosh, these patients are not lying. So that was annoying, but my husband is an ICU doc. He worked in the ICU down the street, and he would come home and tell me, I just saw your partner's patient who got admitted for DKA because they couldn't call your clinic. They couldn't get anyone to answer their phone. And I was like, what is this? Like, we're not even delivering care. The patients are getting sicker because of us. And to me, that was unacceptable. And so motherhood is a powerful motivator, I will say. And so my first child was born when I was a fellow, and my son was born when I was in my first year of my job. And I recognized that I wasn't doing great for the patients who were coming in to my clinic, despite doing my very best within the system that wasn't working. I wasn't doing great for my kids either, being away from them. And so if I was going to be leaving the house, I needed to change lives, perhaps change the world, do something meaningful. And so that's what I set out to do. I thought my partner's patients kept asking to switch to me. So I was like, well, people like me. I'm good with the patients. The patients like me despite this crazy system. Let's try a different system. And thanks to some people in this room, I learned about direct primary care. Nobody was doing direct endocrine care, but I thought that the model would work well for endocrine. And so that's how I started, and it's grown from there.
That's awesome. Thank you. So leaving this system, there's bound to be a lot of challenges, also empowerment. If you both want to address that, just like talk about that transition. Like, what challenges did you face kind of immediately and maybe farther into your practice, and that whole sense of empowerment?
So I think the challenges were, I started my practice in 2019, and nobody believed that this was even an option. Nobody understood the why behind it. Nobody, even my dad, who is, the loveliest person in the world, he was like, in the most loving way, but why would anybody pay you to be their doctor? And, there was a lot of doubt from everybody, really. There was a lot of, this is going to fail. And I think that was the biggest challenge in the very beginning, but I don't know, maybe I had some grandiosity that maybe I believed that I had the power to do something bigger and better for more people. I just truly believed that in my soul. So while it was a challenge, I didn't really take it too personally. And I understood that people just didn't know what I knew. And that's a big one. And then starting a business, right? Like starting a business with no business experience, no business background, trying to get buy-in from people, that is really hard. There's a lot of ups and downs, and you have to be really committed to the why, the intention behind your practice. It is about something so much bigger and more human than money. It is about really changing the way care is delivered, the way people believe care can be delivered. And so I feel like while, yes, there have been a lot of challenges, they've really fueled me, enabled me to build a story around this, which I wouldn't have been able to without those challenges.
I love that. And I think that just thinking about, because your specialty care as, in your background and your current clinic, and I think about the direct primary care in the primary care sense, I think that it makes me think about, when it comes to empowerment, I am very grateful that people like Garrison Bliss, people who went and did this before you and I came into this movement were out there showing us, just like Dr. Smith mentioned, that this is not some kind of like unicorn, no one else can do it. It's something we theorize about, that this is an actual model that will work and make you financially not only able to put food on the table, but also to financially buy your own autonomy. And I think that the empowerment for me came the second I pressed send on my "I'm not gonna go to work for you anymore" letter. It was like 2 sentences. And the plan at the time was that my husband, who again is a family physician, was going to stay in fee-for-service while we transitioned and I opened my DPC. But at the time, I didn't realize that the second that I pressed send, I felt such peacefulness and freedom. I didn't freak out. I didn't worry about how am I going to put food on the table with 0 patients. It literally was realizing that I could craft my future. And when I realized that I kept hearing the stories of fellow DPC physicians from conferences, from talking with people in person, that is where I pulled my empowerment from. And that is why I'm absolutely honored to be on this stage with you guys to highlight that, because it is through being with each other that it's a realization that we have our community here that empowers us and that fuels our batteries for the next day. It's really painful sometimes to go to a non-free market, DPC, direct specialty care focused conference because I see zombies, I see sheep. And not to say that that's an individual take on individual doctors, but it's just there's so much buy-in into the system that I do like saying the red pill because everyone's seen The Matrix. And when you have the veil taken off of there is only one way to do things, and then when you have people around you saying, yeah, you can, I've done it, so can you, it is the definition of empowerment for me.
I think the clarity that comes with leaving the traditional setting job is just insane. I remember telling my husband, within a couple of days of leaving my traditional job, I told him, I feel like I can think. I feel like I can think again because I was off of the hamster wheel. And I was young out of fellowship when I started my practice. I was less than 2 years out of fellowship, which everybody, that was kind of the naysaying of you need more experience, get more experience. But I actually think that it served me because I hadn't entrenched myself into the system. I didn't have patients that I had for years and years. I also did not have a lifestyle yet. We were still like living on our residency budget with 2 kids, and that enabled us to be lean. And my husband had a lot of medical school debt at that same time. People told me, wait until the debt is paid off. No, my brain started working, right? So we figured it out. We knocked it out. There was no option of not making this work. It wasn't possible for this not to work. So we had to make it work. But I think getting out of the system really enables you to explore. And, as a physician, your mind is smart. You can do a lot of things with it. But if you're stuck in the trenches of a system that doesn't serve you and you're constantly battling moral injury and fighting tooth and nail just to do what's right for patients, you can't think.
Yeah. Well, and kind of transitioning over from, leaving that practice, getting that empowerment, just let's think about your leadership and your influence. Both of you have built personal brands, amazing platforms. Talk about the role of storytelling and how that's really shaped your influence in our industry.
So story is absolutely at the corner of everything, at the center of everything that I do. I find that when I reflect on being a physician, my father was a social worker, and every time I would hear stories about what he did at work, I thought about this a lot when I was opening my DPC clinic, and I thought about how again, back to empowerment, that empowering it was to hear other people's stories. And I found that when I transitioned out, people ask me, "Oh, did you go to journalism school?" And I'm like, "No, I'm Filipino. I just talk like this all the time. I ask questions just by nature." And I found that was a way for me to react to this righteous rage that I was feeling, that this is not right what our patients are experiencing. This is absolutely not right for people who are coming up the ranks in medical training to not know that medicine is a business in the traditional healthcare system. And when you go into writing your medical essay to get into medical school, you're so bright-eyed and bushy-tailed. You're so dedicated to serving others. And nobody actually wants you to do that when you are, compensated by number of heads seen per day. That's why I say cattle and not humans a lot of the time. And so when it comes to story, the stories I find are what stick, because they've stuck for me. They always stick for other people. And that's what I get from my patients. When I know my patients, one, because I don't take care of 2,000 to 4,000 people anymore, but I know more about my patients, I'm sure you do too, than ever before. And I took care of these patients for almost 6 years. I'm like, I never knew you had a granddaughter named Sadie. Oh my God, I didn't know you had 18 cats. Like these little details they're really at the center of relationship, and that's what my patients value now. But that relationship is built through sharing stories. My patients love when I say, "Oh, guess what I learned at a conference that I was at this week?" And they're like, "I didn't know that that's happening." So then they tell more people in our community about what's happening with healthcare in America. So for me, story is so important. I'm very passionate about highlighting the physician-led care story. And then recently I was very lucky to go to Ashtabula to record patient stories, because I really think that comprehensively we need the patients to share their own words as to how they understand and how they interact with what we're doing, for other people to come into the fold and to understand. Because if you really look at it, we're doing old-fashioned medicine in 2025. But at the same time, people have forgotten that, because the culture that we are in is, "Oh, I'll just bill it to my insurance, without thinking. You don't ask your car insurance how much what day you can change your windshield wiper on, what finger you use to pump the gas. These things you don't think about. But with healthcare, the culture is so much different.
Yeah, I agree with everything you said, Maryal. And healthcare is personal, and we need to hear the people's stories. And I think I've always been captivated by stories in general. And I think actually we all are. I think a lot of us make decisions about what we buy, what we do, based on the story around that experience, what we're going to feel by having dinner at X restaurant, or by what we're going to experience, right? And so I think story is very, very important in how we as a community communicate. And so I think, especially in something so personal as healthcare, this is really how we can tell people what we're doing. I mean, yes, do we have validated outcomes? Sure. But what does that actually mean for a person? What is the meaning of that? And story is how we get there. And so I've been captivated by stories probably my whole life. I was like, I still have the dictionaries and thesauruses I would ask for my birthday when I was a kid. I actually was a journalism major at Northwestern. So I studied journalism while I was a pre-med. And then when I was in residency, my husband used to call me the queen of the social history. When I was in medical school, everybody said, don't do internal medicine, don't do endocrinology, do a surgical subspecialty, do something that makes more money, and do dermatology. But I just wanted to hear the patient's stories. So I wanted to hear how they got there. And so I was like, I'm going to be an anesthesiologist. And all I would want was the patient to wake up so I could talk to them and hear them. I was like, this this is not the right fit for me. So endocrinology was that perfect balance of really getting deep into the weeds of like, how did you get here? Because diabetes, just at least especially type 2 diabetes, it doesn't happen overnight. It's a lifetime of choices and experiences that get people there. And I think truly understanding and connecting with that enables me to care for people better. And so I think that story is key to the way I think and learn. When you read something in a textbook, it doesn't stick like when you see a patient and you hear that thyroid bruit for the first time and how that feels, or you hear that heart murmur the first time. You never forget that as a doctor. The first time you were able to make a diagnosis based on a patient's story, the first time you felt someone pulseless and initiated CPR, we never forget those moments. And so story is so key to how I learn. I think a lot of us learn, and it's key to being a great doctor too, is appreciating the stories of others and your patients. So yeah, story has been huge for me, and I've learned a lot about storytelling as I've grown through some of the, we love Donald Miller's story brand. You said stories that stick, so I'm thinking, Kendra Hall. And yeah, I think there's a lot that we can accomplish together, all of us, through storytelling as well.
Thank you. Yeah, so thinking about your influence in this industry, Maryal, you had, just from the early days of when you started your DPC practice up through current, what kinds of things have you seen both in terms of wins and resistance to really shaping and driving influence?
I think that in this space, it's different now versus when I first started learning about DPC in 2019. And I think that people are more eager in the physician space to want to know, is there a different way? Like you see Google search terms going up crazily when it comes to how can I practice without insurance? Is there a different way other than CPT codes, ICD-10 codes? And then you also now, which is fantastic, you see people who are specialists in building plans, community-owned health benefits. You see people who are working with employers because the employers now, so more than ever, are asking, wait a minute, is there a different way of doing healthcare that actually gets us healthcare and not insurance? That's fantastic. And so I think that when it comes to just this idea of leadership and speaking out, for me, that has not been the focus. One, I'm just pissed off as hell because of what happened with my own being threatened to be fired. And that really fuels me. But also, I find, again, that it is so important in terms of my purpose in this movement to help elevate the physician's story and now the patient's stories, because this is the right thing to do. This is what brings everyday Americans the health care that everyone deserves, no matter their creed, no matter their geographic region. And for me, that makes me feel good that is a part of my legacy that I can leave behind for my own children and future physicians who hopefully don't have to deal with the traumas that Arti and I went through, because they'll know earlier on. And we're seeing that. Medical students are saying, I'm planning to do DPC once I finish training. I'm like, you guys are way smarter than me.
Yeah, and that's a good point. And we do have, and for those of you in the audience, we do have several medical students here and residents. So maybe let's give them all a round of applause. And thank you to the Benjamin Rush Institute and Do No Harm for making the scholarships, and Christian Health Share Ministries for making that possible. But, and really along those lines, Arti, mentoring the next generation of residents. I know you do some mentoring with your TPA clients and others that are working outside the clinical field. How have you really stepped into that mentorship role to really drive the adoption of direct care?
Yeah, so it's been such a fascinating journey for me. And I think I've used several platforms to sort of share that journey. And it's been, I didn't even know what I was doing at the time, but I think it has, I built an Instagram platform, and I share it on a bunch of different social media platforms. And I just started a podcast this year called Endocrine Matters. And the goal of that podcast is to highlight unique concerns of female physicians and the healthcare system, with the goal of really bringing doctors and patients together, because I believe that doctors and patients are the most important part of the healthcare system. The healthcare system doesn't exist without the clinicians and caregivers and the patients. However, somehow we've been pushed out, and everybody else is more important. And I think that if we come together as healthcare providers and patients, we will be so much stronger, and we can actually do something. The problem is that systematically that relationship has been destroyed to take away our power as physicians, other types of clinicians, and patients. And that is one thing that I'm really passionate about and excited to continue to use story to help bring us together. As far as mentorship, I do mentor medical students as well to teach them about direct primary care, direct care in general, in our clinic, so they can rotate through our clinic. And the other thing is I've brought other physicians into the fold. In 2023, I was doing pretty good. I was happy. And thought about growing more into the employer space, but I was pretty stable and good. But as innovators do, when we get stable, we get uncomfortable. We like to live in discomfort. And so I thought, if I don't grow this and we have these great outcomes in people living with diabetes and we can reach people, nobody else is going to do it. And so let's grow. And so I've been able to hire other endocrinologists to work on my team and mentor them in delivering similar care to what I've been providing, and to offer them a culture and a work environment that I wish I had. Frankly, I wish someone had created for me, where we can support our patients to a higher level than we would in the traditional system, and support our families and our lives as well. And where we can look forward to working. And my favorite thing is, one of my physicians tells me all the time, she's like, I don't have the Sunday scaries anymore. I love my job so much, I don't have the Sunday scaries. And she's like, my husband says I'm in such a better mood now. And so I feel like that's been a very just an incredible way to support others and bring others into the fold. And since when I started, there was no other direct care endocrinologist. We have a Facebook group where we kind of share tips, tricks, and I've offered a lot of advice because I was the first one. And I'm excited to say since 2019 when I started, there's more than 30 practices that have developed around the country. And so this movement is really growing, and I'm trying to lean in to encourage people to go into it, and also make the barrier lower so that they can come into it and feel like they're going to be successful more easily without all the fear and without any guidance or support. When I came in, I was the first one, and now if I can make it easier for others to come in, I think we'll just grow and flourish.
Yeah, thank you. And we've heard, that you are both running really successful practices, but you've taken it such a larger step forward. You're launching initiatives, you're engaging employers. You both have really, really powerful education platforms. But talk to me about what you're doing, whether that's at the state level, the federal level, local, partnering with TPAs. What are you doing outside of there to really drive impact?
For me, I will say that I totally agree with the innovators tend to live in this world of like, oh, it's too stable, we have to keep going. I really find that the more and more I hear what is going on out there, I really get ignited with new ideas and different ways to, provide that education and what I'm learning through story most of the time to other people. So I realized as I was going along interviewing, over 250 physicians already, just doing direct care and direct primary care, that people were, saying, I don't know where to look for others, solutions on my journey to be able to achieve what I need to. So whether that be, marketing solutions or pharmacy solutions. And so I created the DPC directory as like a Yelp for people to go to look for resources within our niche, within our community. Because I really feel that I am so passionate about helping others be successful at their practices. That's why when I ask people, whether they're in person or whether I meet them at a conference or virtually, I really love learning from people all the time, because I'm always thinking about, when somebody says something to me, you should actually check out so-and-so. A person was asking about, do you know somebody to help out with employers in Ohio? And I was like, yeah, absolutely. Dr. Amy Meckley, here you go. Here's her email. And I love being a connector in this space, because I do think that I agree, when we are coming together and helping each other through mentorship, through coaching, through conferences, whatever it is, you really get to see you can take a step back and not be surprised at how fast this movement is growing.
Yeah, I love that. I love that you love being a connector, because I do too. I think our minds are always like, how can we do better? How can we connect one person to another to help them flourish and grow if they're doing something that we think is amazing? One thing that my practice does in the community is we try to identify the passions of our team members. So one of my docs is a really avid rock climber. Like, she's really into it. And so we partnered with JDRF to have a rock climbing event for people living with type 1 diabetes. And she spoke with them, and it was just a way to connect on a different level. And I think a lot of the distrust and dissatisfaction with healthcare is in many doctors' inability to connect with patients. This might be due to limited time. This might be due to overwhelm. This might be due to their personality. This might be due to that wasn't what we were trained for. Lots of reasons for it. But what we've learned, especially in the diabetes and endocrinology space, is that connection is healing. And I believe that a part, at least, of the outcomes we're able to deliver are because of that connection and relationship. And so we've tried to go into the community in ways that are authentic to us, to connect with people on another level, so that they can understand, hey, doctors are actually here for you. They are like you. We have more in common than not. And I think our patients, at least I feel this way about them, and I hope they feel this way, but they're not just my patients, they're my dear friends, and they're almost like family to me. And so I'm going to go to bat for them. And if we can build a community like that, I think it's obviously great for the patients, but also great for us. We don't lose by giving, we gain by giving. And so that's what we've done in the community. And then I've been very lucky and grateful to work with the Kempton Group and TPAs to offer our services to employees through their employer. And it's kind of a win-win-win. The employees win by getting longer visits, great supportive, accessible care. The average wait time to get into an endocrinologist is 3 to 6 months, and 75% of US counties don't have a single endocrinologist. So we're able to give patients access where they wouldn't have access before, and to better high-level care with truly excellent outcomes. And so it's a win for the patients, and it's a win for the employer because we keep their employees out of the hospital, which, as we all know, the hospital is a huge driver of cost. So while it's the right thing to do for a person, it's also right for the company's bottom line. Diabetes is the costliest chronic disease that our country faces. So that's a win-win, and then it's a win for us as the physicians. We get to build those relationships that we love, the reason that we chose this field, and deliver care that we believe is great and is top-notch. So those are a couple of the things that I've done.
I just wanted to add, when you mentioned authenticity, I think that also something that I've been involved in, which is rooted in authenticity and telling story, which I was sort of shocked by, was when it comes to policymakers, people who are doing research in healthcare, the just sharing what you do every day really makes them lean in also. One, because they want better for their constituents. When I've been on the Hill talking with staffers, that's a big thing that they're really concerned about, and for obvious reasons. But when you're able to just say what you do, and then they understand through your everyday experience as a physician, I noticed this in February when I went to DC. People were still asking, so what is direct primary care? And then by the time I rolled around in September when we went back again, people were like, all right, so no, we already know what DPC is, but now I need to know who's doing it in our community. I need more examples, because people are wanting, again, a different way. And through speaking at whatever level, county, state, nationally, these stories do matter. When it came to speaking up at the state level, the California Academy of Family Practice does not have anyone on board who does not take insurance. And I was so mad about that, because it's not equally representing the body of physicians who are doing family medicine in California. And when we realized this as a group of DPC doctors in California, we said, how can we solve this? And together we put our heads into a plan, and we work together to present a resolution that says direct primary care, consistent with the AAFP. Direct primary care is a relationship between a physician and their patient, and we are not in the business of insurance. And we got that resolution passed just this past March at the All Advocacy member meeting. But it's because we are coming together again with our authenticity and with our stories, that people are changing policies or the way that they think about policy.
First of all, that's amazing. But I think physicians sharing their story is very important. And I think physicians have made a grave mistake in sharing stories by not differentiating the fact that reimbursement is not equal to physician take-home compensation. And I think that we have talked about reimbursement incorrectly for a long time. So patients, people, the community think it's physicians crying about not getting paid enough while making multiple six-figure incomes. And people don't have sympathy for that. And why should they? Why would they, right? They shouldn't really have sympathy for that. And it's really not about sympathy, right? It's about physician reimbursement is directly related to the resources that we can put into care. Hiring good staff, hiring a good physician, having adequate time with patients, having supplies, having office space, all of these things, the overhead that it takes to run a practice is going up while reimbursement is going down, and it doesn't make good sense. The other side of it is, if physician compensation goes down, we've already seen this, people aren't going to go into medicine because the debt is so high, the pay is so low, and more than just pay, the opportunity cost, right? My husband's an ICU doc. He works 15 hours a day. He loves it. That's why he does it. But, it's a toll on your body, your family, and there just aren't that many people who are going to be willing to do it anymore. And there may not be people to take care of us when we get sick. And so these are the reasons that reimbursement is important. It has very little to do with actual take-home pay for physicians, but we have not done a good job of clearly expressing that. So I have really tried to kind of remodel the story to what declining reimbursement really means for you, the patient, who is the actual important person in the picture, not so much us as physicians crying about our salary going down.
Yeah, and just like wrapping this up, we have this whole room full of people who believe in change. They want to do more. What advice would you give, both of you, give the people in the audience on what they could do in their communities moving forward?
I know Dave is here, but I'm going to take a page out of Dave Chase's book. Whatever we're doing, thinking about how we're going to do it locally in our own communities, that's the lens that I would put over anything that you hear, learn, think about this weekend. Because when it comes to the most effective care, we know that it's going to be a hell of a lot different if somebody in Calaveras County is speaking to the needs of Calaveras County versus somebody in the Ivory Tower in DC telling me about healthcare in Calaveras County, of which there's hardly any. And so I think that by taking whatever you hear or learn about and then saying, how can I then translate this into my own community? I think that's the number one thing that will create, the ability to take a next step after this conference.
I think that's great. And I recently did a podcast with Wendy Dean. You guys may have heard of her, but she has a podcast called 43cc, and they talk about healthcare system issues and moral injury in healthcare. She's kind of the expert on moral injury. And I asked her this same question at the end of our podcast, so I'm going to steal a page from her book. She said, do something. We all have different passions, different skills, different resources, different contacts, different networks. So what we as individuals can do is going to be different from the person sitting next to you. But I think what we all are talking about here and what we're taking away is that healthcare is terrible for patients, how it is traditionally given and prescribed to patients and physicians. It needs to change. We are all working to change that. So do something that you can do, whether it's small or big. Do something. Think about it every day. Think about, what can I do? Tell our stories to somebody. That's doing something. Just have it at the top of mind so that you are doing something to advance better care for our patients and our communities. And don't belittle what the thing is. Don't feel disempowered, because every little bit counts. Everybody talking about this to another person and introducing somebody to the idea of direct care, introducing CEOs and executives to the ideas of direct contracting. This is where it starts. Everything starts with an idea. So do something.
Well, thank you so much. And Dr. Concepcion and Dr. Thangudu, thank you so much for the bold, brave moves that each of you are using to advance the game. And thank you.
Thank you. Thank you.